Hey there, I'm Dayna Johnson, dental practice management expert, certified Dentrix trainer, and founder of Navoni, revolutionizing the dental industry through innovation and strategic leadership. It wasn't long ago that I lived in your shoes, navigating the daily challenges of managing a dental practice with the hopes and dreams of having a productive schedule, money in the bank, and getting home on time to my sweet daughter. After 25 years working in the dental practice and 17 years as a certified Dentrix trainer, I found my life's work, helping dental teams one-on-one, optimizing their systems and software. If you are looking to create the thriving dental practice you have always dreamed of and empower your high-performing dental team, you are in the right place. Let's get started.
Hey, welcome everyone. And we are getting ready to kick off the second quarter of the year. We're in Q2 starting on April 1st. And anytime we kick off a new quarter, I'm always here with my friend and colleague, Claire Dickinson. She's the operations director for Puget Sound Perio. Welcome, Claire.
Hello, how are you?
I'm great. We always have to start off by talking about a little personal stuff.
Yeah.
I was looking at our pictures from the weekend, and you were out paddling on the Puget Sound area, and then I was hiking up in Arizona. So we were both outdoors this weekend.
Yeah, beautiful weather in both areas. So
I know.
outside it was.
I know. I was totally jealous that you were out on the water.
Yeah.
Because I'm kind of a water girl.
Yeah.
But
First nice weekend of the year. So I enjoyed every second of it.
Oh, yeah, I loved it. And then I climbed all by myself. I climbed on Saturday. I had a hiking day all by myself. I climbed up to the top of Camelback Mountain in Arizona while my husband Kevin was covering baseball games at spring training. So it was super fun.
Yeah, it looked amazing.
Yeah, it was great. Okay, so for Q2, we are going to talk all about the hygiene department. And I would like to go over a couple topics with you so we can kind of kickstart the content for the rest of the quarter. And so there's kind of like three things I was taking notes about before we got on the phone just to do our podcast. There's kind of about three things that I think we could summarize and kind of kickstart the quarter about. I want to talk about how the hygienists can be a little bit more proactive. When we're starting to kind of creep up on the slower summer months.
Mm-hmm.
And then I want to also talk about how to get the hygienists on board with kind of just really understanding and recognizing the reimbursement rates that our doctors are having to take, with hygiene, and how they could be more involved with understanding what they need to produce in order to help the practice be profitable.
Mm-hmm.
And then that kind of ties in with our Perio program at a general practice. So those are kind of like the three high level topics that I want to jumpstart our Q2 with. How are you feeling about those three things?
Let's get after it.
All right, let's do it. Okay, so let's start with the easy one. The easy one is kind of preparing our hygienists for the upcoming slower summer months. I always see that offices have a little bit more of a challenge keeping the schedule full in the summer because, of course, we're out on vacations and we're spending more time outdoors. And when especially up in the Pacific Northwest, when there's a nice day, everybody wants to be outside.
Yeah.
So kind of what's your experience with how can the hygienists be a little bit more proactive when it comes to keeping their schedule full?
Yeah. So I always encourage pre-appointing. Nobody leaves the office without an appointment, regardless of whether or not the patient says, yeah, gosh, I don't know what my schedule is 3, 4, 6 months out. Say, awesome, Dayna. I appreciate that because our schedule fills up so quickly. I just want to make sure I secure appointment time for you. If something changes as we get closer, we'd be more than happy to reschedule. and to be able to solidify an appointment time for you so we don't make sure we miss you, let's get it on the books. And so it's just, and it's always better from the hygienist than it is, let's say, a business team member, because the patients are more indebted to the their particular hygienist than they are the business team people. They'll just say, yeah, yeah, okay, fine, whatever. And then they'll leave. Where I've oftentimes seen with hygiene, there's a lot more emotional commitment and they'll keep it, especially considering the hygienist just spent, an hour with them going over, the unique details of that patient's mouth towards health,
Mhm.
right?
Yeah, for sure.
And so, gosh, Tina, I just really want to make sure we don't miss, let's just say they're on a 4 month, recall. I really don't want to miss your 4 month appointment. I'm watching this area. Whatever it is that's unique to that patient, really make it about them. Don't say, I think Ashley just said this, but don't say I want. Say, um, so we can continue towards the path of getting you healthy. Let's get you scheduled for. So it's about them, not about
Mhm.
you. I think that that's really critical.
I agree with that. I agree with that. It always has, because patients always want to know what's in it for me.
Sure.
If
Mhm.
I schedule this and stay on track, how is it going to benefit me?
Yeah,
And that's always, it's always going to be that way.
exactly.
I loved what you said about that we have to tie it to something clinical. Maybe we're watching this area, or we're really getting on this path of health for this patient. Um, I always teach that I always want the hygienist to pre-appoint, because I always agree that with you that they're more have a connection with their hygienist.
Yeah.
But I also really want the hygienist to document that, in the clinical note, I really want them to document the next visit. They need a 4 month or a 6 month visit. And here's a little clip of why we really want that patient to come back in. Like,
Yeah.
because what's the reason for a return?
Mhm.
And the reason I really like having it in the clinical note is that then, if the patient really is saying, okay, I'm not going to schedule, I just can't schedule yet, at least we have that documented in the clinical note so the business team can then refer back to it.
Mhm. Mhm.
Yeah, so I really like that. What do you think about that idea?
I think it's absolutely necessary.
Mhm.
That next visit, I see more team agreements that get broken and people getting upset when we don't take the time to put in that little
Mhm.
little 2-second piece of information
Yes.
next visit. Because as much as we all care, none of us are going to read through the entire clinical note. It doesn't happen, let's be real. So that next visit really summarizes and gives
Yes.
people the tools they need, and it closes the loop in communication, so then we can continue that communication on with the patient and we don't lose them in what needs to happen, right?
For sure.
So,
Yeah. I've talked about that a lot, like the very beginning of the clinical note, like what happened today,
yeah.
and then the very end of the clinical note, what's next. For
Mhm.
me, as a business team member that's, been in offices for 30 years, those two pieces of information are the most critical for our business
They
team.
are. Yeah.
And that can really help the hygienists be more proactive about those upcoming slower summer months, because, you know, kind of referring it back to something clinical with the patient could make the patient decide, well, okay, I really need to come in for my hygiene visit rather than, go out and play a round of golf today or whatever it
Sure.
might be.
Yeah. 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 And you need in hygiene, I encourage hygienists to your time is super valuable. Create value for your time. Covet your time. And,
Mhm.
make it, don't say, just for your hygiene appointment. Don't use the word just. Like,
Yeah.
that time with you is super important, and what you are offering is super valuable. So make sure your communication and your language that you're, using with these patients, that they understand that, right?
hmm Absolutely. Absolutely.
Mhm.
Language and verbal skills are so critical
Yeah.
when we are creating that value for the patient about
Mm.
oral health.
Yeah.
Yeah. Yeah. I think a lot of times patients forget that we are a healthcare facility.
Yeah. I think so too. But
They do all the time.
yeah.
Uh-huh. But in addition to being a healthcare facility, we are also running a small business. And we also have to be a profitable small business.
Mhm.
Of course, unless we're running a community dental clinic or something.
They have to be profitable too. They do.
Yeah,
And
yeah, that's true.
and I'll interrupt for just a second if you don't mind. Profitability doesn't mean what we put in our pocket. Profitability means that we can buy the supplies that we need to buy. We can turn on the lights. We can have the insurance to be able to practice. We can have equipment to be able to do what we want to do.
Exactly.
If that, let's say, productivity profitability is not there, then we have to make cuts that significantly will affect how it is in effort to be able to give the care we want to give. So,
Exactly.
I think that there's a lot of being that we're all, natural caregivers, and sometimes the conversation of money is a little bit of a conflict
Hmm.
internally for what it is that, we're trying to do. It is a very necessary conversation because we have to be able to do it. This stuff just doesn't appear, right? So,
Hmm. No, I'm glad that you defined what profitability is. It's not that the profitability gets to go home with the doctor. That's
mhm,
that's not what profitability is all about. You're right. Profitability is that that's where our raises come from.
yeah,
That's where if our doctor is giving us healthcare benefits, it's coming
yes,
out of that. If we're getting new uniforms,
hmm,
all of that comes out of the profitability of the practice. And I think it's really important that our practice owners, our doctors or practice owners are more transparent about what do we need to produce and collect in
yeah,
order to be a profitable business.
hmm,
Because a lot of times our team is asking for raises. We've been there a year, we've been there 2 years, we haven't received a raise, we're asking for a raise, and we don't, as a team member, if the doctor or the practice owner is not transparent about, what it looks like to be a profitable business and give raises, then we just think that we're not going to get a raise, or why? Because I'm working hard. I'm working harder than I've ever worked before.
yeah,
And they don't understand that.
right. And it could be more than what you realize.
Hmm.
So,
Yeah, yeah. So I want to dive into that a little bit
yeah,
more, because our what we know that reimbursement levels for insurance has not increased
hmm,
in the past 30 plus years.
hmm,
Reimbursement levels, patient um, maximum benefits for the year have not gone up. Reimbursements have not gone up, but our wages have gone up. Our supply costs have gone up. So
everything.
disproportionately,
Yes.
there's this balance that is not keeping up.
Yeah.
And so we want our hygiene department in a general practice it has to be a profitable part of the practice.
Ah,
And so I want to hear your thoughts on how our hygienists could be more involved, and our doctors could be more open and transparent about what our hygiene department, the production, and what does a hygiene department need to look like in order for it to be productive and profitable.
yeah. I'm a huge proponent of like full transparency. And I encourage hygienists to think of their chair, their room as their own business.
Mm,
It'd be very similar to like not that the professions are the same, that's not what I'm saying, but if you were a hairdresser, that is your business. What you do in that chair is your business, and that's how you create wealth for yourself. Hygiene, think of it the same way, right?
mhm.
And so um, hygiene is a separate business within the actual office itself, and should be run as such, in my opinion. Um, and you know, if if as a hygienist you can conceptualize and get on board with what it is that you're producing, like not necessarily per hour, but per visit with that patient, um, and then this is super high level, but And if your doctor even wants to have this conversation is, okay, so this is what my wages are versus this is what I produce. Like, how can you have future conversations about, hey, doctor, I've been with you for 5 years, whatever amount of years. I'd like to have a conversation about wages, and this is where I've produced more within the practice. So,
Okay.
or I want to have better equipment, or I need new instruments, or I want better supplies. All that comes from hygiene itself. And so if your reimbursement is only so much, let's say you have let's say it's $79 for a prophy, right? And
Mhm.
um, what else could you do that would be in the benefit of the patient? I'm not saying upsell anything that's not necessary to the patient, but benefit to the patient. Does the patient need fluoride? Does the patient want Botox? Like if your office does Botox, that can be done in hygiene. Like it literally, right? Why
Mm.
put that in the doctor's chair? And I'm sure depending on the practice, there's some way to incentivize, both departments. So, there's a benefit for all, but patients want that stuff.
Mhm.
Fluoride, making sure that we don't miss x-ray frequency. That I see x-ray frequency get missed all the time. And it's not that these patients don't need them because they do, right?
Mhm. Yeah.
And being really in charge of your chair and what your patients need and driving it instead of, um, you know, one thing that makes my hair get grayer is when I have a conversation and I'm like, and the hygienist is like, well, I just did what was on my schedule. No,
Yes.
your business team members, they're just scheduling, not that they don't know, but that you are the clinical provider. So you drive what ends up on your schedule and what you're doing with those patients and how efficient with your time you can be in the services that you provide.
Yes.
Your doctors will hugely appreciate that if you do. And then it benefits everybody short term and long term in
Mhm.
all the other conversations that we just talked about, right?
Yeah, absolutely. Yeah. And if the hygienist is taking ownership for their chair,
Yeah.
then and they are pre-appointing the patient for their next visit, they
Mhm.
are also scheduling appropriate amount of time for that patient.
Yes.
So not every patient needs an hour.
Yeah. True.
Some patients might need an hour and 10 minutes.
Yeah.
Another patient might need 40 minutes.
Yeah.
So why schedule a healthy adult prophy for an hour when you only need 40 minutes for that
Sure.
patient,
Yeah.
and so also I think it's also important that that the doctor, the practice owner is also open and transparent about those production goals so that the hygienist knows what are my parameters,
Yeah.
what is my chair? If I'm going to be in control and own this chair, what do I need to produce in this chair in order to be a profitable part of this practice so that I can get those raises I want, I can get those new instruments that I want, that I
Mhm.
can get new scrubs that I want. What do I have to do, doctor, in order for me to get what I want out of the
Exactly.
practice?
Exactly. Another little side benefit too is, we always have to take into account like availability for patients, right? And so you always hear these conversations as a team member. You want to take vacation, the doctors are like, we can't afford it. Like you can't go. You should take vacation only when I take vacation. I have a belief that if we were taking full ownership for our chair time and what we were doing in that chair time, that maybe the conversation would be a little bit more loose in the fact that say, hey, I'm in a future pace when you're out. I'd like to take a week during this time. This is what I'm projecting that I'm going to do per month, you know, high level stuff. But if you got there,
Mhm.
I'm sure that the doctor would see that vacation time as being different, right?
For sure. Yeah.
Yeah, because you're like a mini associate within your office and you're driving that department or your piece in that department.
Agreed. I agree with you 100%.
Mhm.
And also I also see that a lot of offices will ask their hygienists to replace themselves if they are going to be on vacation.
Yes.
So if the
Mhm.
office is open to having a temp come in, then the hygienist can schedule their own
Yeah.
temp to come in
Yeah.
and take vacation, when they want,
Yeah.
because they have filled their chair.
Exactly.
Yeah, this is good stuff.
I
My,
Go ahead.
Oh, I was just going to say that, when I was in a practice, my doctor was very open and transparent about practice numbers. He shared overhead numbers with us. Of course, nobody knew what our salaries were. It wasn't that transparent,
Sure.
but, we had high level numbers like our staff salary had to be at 22%, and our, overhead had to be, I can't remember what it was. Can't remember, but so we
Yeah.
got those higher level numbers, and then we budgeted back from there. So if we needed our overhead to be at 60%, then what do we need to produce and collect in order to get there?
Mm-hmm.
And that's what was shared with the team, was this is what we need to produce and collect, because it's based on those overhead.
Yeah. Yeah. I love those conversations. Not every practice is set up that way, and I respect that and appreciate it. But it is helpful to get the team members involved in conversations like that,
Mm-hmm.
because you'll start to see a cultural shift over time where they start to take more of a stakeholder position versus de- be just coming to work, I guess, right?
Yeah.
And so they're like, gosh, if I do this, it means this. And, there's a lot more investment in time. And some people really appreciate being part of the process.
I agree. They do. I like what you said about being a stakeholder.
Yeah.
You're not just an employee walking in every day. You're like a stakeholder in this
Yeah.
business.
Yeah.
You're influencing the profitability of the practice. And when you do that, you must be giving the patient optimum health care if you
Yeah.
are a profitable hygiene department.
Yeah.
Yeah. So the final thing I want to talk about is like Perio in a general practice. Because anytime I do an assessment, so anytime I'm going to work with an office one-on-one, I always remote into their software, and I'm looking at practice reports, I'm looking at numbers. And one of those numbers I always look at is the Perio percentage.
Yeah.
And because I want to see, are they within industry levels? And we want to see our Perio programs over 20%. 30% is better, because we know that studies show that over 50%, it's probably slightly over 50% of adult Americans have some form of periodontal disease.
Mm-hmm.
And typically what I see, sometimes there's some outliers, but typically I see Perio programs less than 10% in a general practice. And, so that's one of the things that I am always talking to practices about, is building up their Perio program. And it's really hard for the team to get on board with that. What kinds of ideas and suggestions, recommendations do you have when it comes to Perio in the general practice?
Yeah. I see undiagnosed perio a lot as well.
Mm-hmm.
And a lot of the time, it's because either subconsciously or consciously we're afraid to have a conversation with the patient, um, because it's surrounding cost, right?
Yeah.
However, I will encourage everyone to know that is called supervised neglect, and that patient will go somewhere else at some point in their life, and there will be a conversation by another provider where this could end up being talked about. And I don't know how many times all of us have had situations where we've had a patient in the chair and the patient's like, my other provider never told me that, right?
Mm-hmm.
Most often it's okay. There's not a big deal. There will be times where it will be a big deal and it will be an issue. So I understand that it can be difficult to let a patient know, gosh, we can't see you as an adult prophy, which is covered at 100% by your insurance anymore, right? And we do need to do, scaling and replanning or perio maintenance or whatever. but come from the position that it's not our responsibility to worry about the cost or the insurance affiliation. We are not insurance experts. We're not financial advisors, and we do not know what the patient's, position is. We are caregivers that have unique skill sets and licenses. And our required responsibility when we took that oath to do that is to diagnose and to give patients choice about their treatment. So, that's I feel pretty passionately about that, you have to be okay with having that conversation. And it does happen where you have a patient that's been an adult prophy forever and all of a sudden something changes, right? And that can invite a whole nother conversation. A practice that I was at for a long time, we had a patient that was stable forever. All of a sudden, everything completely changed. And we found that the patient actually had diabetes and he didn't know, right? So there's so many positives that can come out of it by being focused on we're caregivers, we have a right and we have a responsibility to share what we find and to give patients choice. And, I would, if you see that your percentage of perio is significantly low, lower than what we would like to see, or what we know to be, as you stated, over 20%, we need to analyze the patients that we're seeing and what they're actually presenting with. And if there's some confusion about like at what point would they become a perio patient or not? There's lots of people out there that would be more than happy and willing to spend the time to do lunch and learns to go over, like our particular offices. And I'm not plugging our office at all, but we're very sensitive to not looking like patient poachers for general practitioners. So we really don't want to take over perio for you in that way.
Right.
But we love doing lunch and learns where we meet with the hygienists in general practices, where we talk about, at what point do we recommend this? And then we help them so then they can help their patients, because every hygienist goes through the same school. A perio hygienist versus general hygienist, exactly the same, right? There's no difference. It's not a different specialty. So it is a benefit to us if we educate and help you bridge that gap if there's a knowledge gap there for whatever reason. And then we can increase those perio numbers and take care of patients. So
I'm glad you brought that up, because I think that's more common than you think, because I have a practice here in Colorado that I was working with, and we were working on their perio program, and the doctor did have the periodontist come in and work with the team one-on-one to help them, like, with verbal skills and educating the patient, and how do we move these patients that we've been, treating them as prophies when they're really perio patients,
yeah,
and so I do think that that is more common than you think, that
that's amazing.
your perio practitioners in your area would love to come in and talk to your hygienist about the perio program,
Yeah.
how you could increase it, especially if you are referring out to periodontists for other things like dental implants or
Yeah.
perio surgeries. Those periodontists would love to come in and talk to your hygienist about their, upping your perio program within your general practice. And Claire and I also know there's several really good hygiene coaches in this country too, so we can definitely point you in the right direction. Yeah, it's so important.
It is. None of us like to spend money on, saying like as a patient, you're like, gosh, do I have to?
Mm-hmm.
But I really think if they understood, the consequences of not treating it
Mm-hmm.
versus the benefit of saving the dollar, more often than not, patients will elect health over money. Yeah, occasionally. I mean, we've all experienced the ones who are like, now I only do what my insurance says. Um, you know, I've seen practitioners say, gosh, maybe we're not the right practice for you then,
Mm-hmm.
right?
Yeah,
Because
that's true.
it's really dependent on what you want to do in your practice, but we have a responsibility. So
as healthcare professionals,
Yeah.
we do have a responsibility to talk to them about their disease.
Yes.
And, you said it's undiagnosed perio. I don't necessarily think it's always undiagnosed, but it's like uncoded. It's not coded correctly. A lot
Yeah.
of times they're treating it.
Which is a whole nother
Yeah, that's a
conversation.
whole nother
It's too.
conversation. They're treating
Yeah.
the perio, but they're not coding it correctly.
Yeah.
And
Well,
that's a whole nother
it
conversation.
is. And it goes back.
I'm gonna dive into that a lot more this
Yeah.
quarter.
And it goes into the value of what it is as a hygienist, because you're incredibly valuable, what you're giving to the patient,
Mhm,
right?
for sure.
And so consider that.
Absolutely. I love that. That's a great way to end that the hygienist is such a valuable part of the practice. And the hygiene department is it's a big, there's a lot that goes into it.
For
There's
sure.
a lot of parts, and a lot of people have their hands in it. And I loved how we just talked about how the hygienist can be more proactive about being more of a stakeholder and owning her chair, and and really taking ownership for the scheduling and the
Yeah.
profitability and the diagnosing and all of that. I think that's really, I just love
We
that. This was a great conversation.
we give our hygienists the autonomy of pre-blocking their schedules.
Mhm.
So, we talk about goals. They know what their goals are. They're very active in achieving their goals. And they will pre-block instead of the business team members pre-blocking or doing perfect day scheduling of
Mhm.
what they think they can do. The hygienists are like, no, this is, and obviously you need to have some flexibility in there because things change throughout the day or whatever. But
Mhm.
no, they own their schedule for sure. And they love it that way because then it gives them the autonomy to where if they have they're not set in like
Mhm.
this bookend of you have to have, 90-minute
Yeah.
scaling and route planning for 2 quads. Well, this patient's super difficult
Yeah.
or whatever the reason, they love that autonomy. So,
Yeah. Yeah, I love giving them that freedom to
mhm.
just take care of their own schedule.
Yeah.
And we are, over the next 3 months, we're going to be diving a lot more into goals and how you get your goals into the computer. We're going to talk more about clinical notes. We're going to talk about more about perfect day scheduling. So we'll dive a lot deeper into those topics.
Mhm.
I just wanted Claire and I to kind of, get the party started with
Yeah.
with with those topics. So,
Yeah.
well, thank you for
Yeah.
sharing part of your afternoon with me and
Absolutely.
kick-starting second quarter of the year.
Yeah.
I appreciate it.
Yeah. Thank you for having me.
Any last words?
No, I'm just super excited that we're moving towards the summer.
I know. Me too. Me too. I'm tired of the snow on the ground.
Yeah.
Oh my gosh. All right. Well, thank you, my friend. And thank you for all of you that listened in on this episode. If you found that this episode was very informative, please share it with your colleagues, your study clubs. Give us a 5-star rating. Like, click on the 5-star rating right now and give us a review. We would really appreciate it. So I hope you all have a great rest of your day. And I look forward to watching your journey of becoming a high performing dental team.